This is Jerry Hesch, and this brief video is on an introduction to palpation and SpringTest practice. Here is a model of the pelvis. I have one with ligaments and I have one without. And we're going to ignore the palpation on the front of the body. We'll cover that in the workshop. There's a nice rule that I came up with, and it's called the rule of thirds. So what we want to do is look at the top of the pelvis and look at the bottom of the pelvis. So the gluteal crease is right here, and you can indent the hamstrings and come right under the ischial tuberosity. And in some individuals, you'll be able to see where the iliac shelf is. And I use the terminology shelf because there is a flat portion right here that is very flat, and you could almost balance a pen on that. I don't like the terminology crest, and the research shows that PTs have a very hard time agreeing with each other about what a crest is, exactly where that location is. The good news is this flat portion, it's called a shelf, is exactly in the middle. So here's the midline of the sacrum and the spine, and here's the outside of the body. Of course, there's some muscle and skin and fat out here, but absolutely in the middle is where I find that landmark. And if you can't see it in the individual, you can walk down from the rib cage. You'll feel bony ribs, and then you'll feel soft tissue, and you'll come down and perch on top of it. So it's as simple as creating two lines, creating a middle third, upper third, and a lower third. So I use my fingers here, and I come down and create a third. And then I use my other hand and I come under the ischial tuberosity and create another third. And guess what? It's very easy to locate with the rule of thirds where the PSIS is. The PSIS is a very important landmark, and it denotes the very middle of the joint. The joint is, inside the joint is shaped like a boomerang. And the very middle of that angle is at the level of the PSIS, which is at the level of S2, the second sacral segment. So in the rule of thirds, your thumb will isolate the approximate region of the PSISs. The lower third thumb, with your fingers on the ischial tuberosity, the lower third will isolate the inferior lateral angle of the sacrum, which is at the lowest sacral segment S5, right above the coccyx. And that's a very important landmark also. It also denotes the attachment of the sacrotuberous ligament. It's kind of a broad ligament, and it also denotes where the sacrospine is, from the spine of the ischium to the sacrum, where that ligament is. So it's a very important landmark, and the rule of thirds has been very, very helpful. And another thing that I like to encourage clinicians to do, and we'll keep focusing the camera on this pelvis here, I encourage them to find a safe marker that they can use in the clinic safely on and mark people's skin. And it will save a lot of time if after first isolating the PSIS, you don't want to mark over their skin right there because you'll be putting your finger there from time to time and you'll rub the ink off. But if you come laterally to the PSIS and put a little X there, then you can just visually look and you'll know that medial to that is where the PSIS is, and you can visualize easily across the street where the other one is. Even with asymmetries and such, it's not going to be significantly further away if there's a side-to-side asymmetry, and basically it's always an approximate guess anyway. If you have an X here and you know that about an inch medially is the PSIS, you still have to do a little bit of palpation work just to make sure you land on the very top of it. But marking the skin is very helpful, and the same is true for the lower landmark in some individuals, but there are other times when, for reasons of modesty, etc., you may not want to mark the skin and such. You could, if they're wearing some fairly tight-fitting clothing, you could put a little piece of tape down there, masking tape, for example, or medical tape that would indicate where that landmark is, but it would be off to the side. And then it's a lot easier. Going back and forth and palpating and trying to find landmarks can be very time consuming and frustrating, and this rule of threes makes that a little bit easier. So I'm just going to show you on a ligamented model the application of the rule of threes. So we put fingers on the top of the shelf, and we come down and mark approximately a third, come under the ischial tuberosity and mark approximately a third, and you'll see that in fact, yes, here's the PSIS, that one was fairly accurate, and that marks the second sacral segment, and the lower third is right here, and that marks the region of the inferior lateral angle of the sacrum, and here you can see sacrotuberous ligament, and here you can see underneath that the sacrospinous ligament. So now we're going to move into the concept of spring testing. Spring testing is a very useful technique for testing mobility and integrity of a joint. These are mutable conditions. They can change in response to treatment, but you